Injuries are common. They happen in life and they happen in sports. For athletes, the risk is even higher. Pushing limits and competing hard can lead to accidents. Athletes often experience acute injuries. These happen suddenly, like a sprained ankle during a game. Overuse injuries develop gradually. They are caused by repetitive stress on a particular body part. Understanding common sports injuries is crucial. This knowledge helps athletes take steps to protect themselves. It also helps them recognize when medical attention is needed. Soft tissue injuries affect muscles, tendons, and ligaments. Sprains are stretched or torn ligaments. Strains involve muscle or tendon fibers. Fractures are breaks or cracks in bones. They often occur from high-impact forces. Stress fractures are tiny cracks that develop over time. Burns are another type of injury athletes may encounter. Friction burns are common in contact sports. Sunburns can be a risk for outdoor athletes. Recurring injuries are a frustrating reality for many athletes. They can be both physically and mentally draining, often leading to a cycle of pain and recovery that seems never-ending. Several factors contribute to this. Understanding these factors is key to breaking the cycle. Improper healing is a major culprit. When injuries don't heal correctly, they leave behind scar tissue that can be weaker and less flexible than healthy tissue. Rushing back to activity too soon can lead to re-injury. Athletes often feel pressured to return to their sport quickly, but this can be a dangerous mistake. Muscle imbalances and weaknesses can also increase the risk. When certain muscles are stronger or more developed than others, it creates an imbalance that can lead to injury. If certain muscles are overdeveloped or underdeveloped, it puts stress on other areas. This stress can cause injuries to recur, especially if not addressed properly. Poor biomechanics and improper technique can also set the stage for recurring problems. Using the wrong form during training or competition can place undue stress on the body. Addressing the root cause of an injury is crucial for preventing it from happening again. This means taking the time to understand what led to the injury in the first place. This may involve targeted exercises, physical therapy, or changes in training techniques. Working closely with medical professionals and coaches can help create a comprehensive plan for recovery and prevention. Section 4. First Aid, your on-field action plan. This section is crucial for anyone involved in sports, whether you're a coach, player, or even a spectator. Knowing basic first aid can be a game changer for minor injuries. It can make the difference between a quick recovery and a prolonged absence from the game. The RICE protocol is a helpful acronym to remember. It stands for Rest, Ice, Compression and Elevation. Rest, Ice, Compression, Elevation. These 4 steps are essential for managing acute injuries effectively. Rest the injured area immediately to prevent further damage and allow the healing process to begin. Ice helps reduce pain and swelling. It's important to apply it as soon as possible after the injury occurs. Apply ice for 15 to 20 minutes at a time, several times a day. This helps to minimize inflammation and discomfort. Compression, using a bandage, helps limit swelling. Make sure the bandage is snug but not too tight to avoid cutting off circulation. Keep the injured area elevated to further reduce swelling. Elevation helps fluids drain away from the injured area. Over-the-counter pain relievers can help manage pain. Always follow the recommended dosage instructions. If you suspect a serious injury, seek medical attention right away. It's better to be safe and get a professional evaluation. Section 5. Prevention is the best medicine. Preventing injuries is always preferable to treating them. It saves time, money, and most importantly, keeps you in the game. Warm-ups are essential before any athletic activity. They help to gradually increase your heart rate and prepare your body for the physical demands ahead. They prepare your muscles for exertion and increase blood flow, which can significantly reduce the risk of strains and sprains. Regular strength training builds muscle strength and endurance. This not only enhances performance, but also fortifies your body against potential injuries. This helps support joints and reduce the risk of injury. Strong muscles act as a protective barrier for your joints. Flexibility exercises like stretching improve range of motion and prevent muscle imbalances. A flexible body is less prone to injuries. Using proper technique in your sport is crucial. It ensures that you are using your body efficiently and safely. Listen to your body and don't push through pain. Pain is a signal that something is wrong and needs attention. Rest and recovery are just as important as training. They allow your body to heal and come back stronger. Section 6. Respect your body, stay in the game. Injuries are an unfortunate part of sports. Understanding different types of injuries and their causes is the first step towards prevention. By prioritizing warm-ups, strength training, flexibility and proper technique, athletes can significantly reduce their risk. Remember, listening to your body is key. Don't ignore pain. Seek medical attention when needed. By taking a proactive approach to injury prevention and management, athletes can stay in the game and enjoy the sports they love for years to come.